I want to talk to you today about something a great many older adults experience but rarely connect to their heart and arteries. And that's genuinely worth understanding because it's both a clue and a warning. The circulation in your legs, the symptoms of poor leg circulation, and what they can tell you about your arteries and overall cardiovascular health. Because people often dismiss leg symptoms, pain on walking, cold feet, slow healing sores, as just aging, aches, or unrelated foot problems, not realizing that poor circulation in the legs often reflects the same artery disease that affects the heart and brain. So leg symptoms can be an important window onto your whole cardiovascular health. So today I want to clear up the misconceptions about leg circulation, explain the condition called peripheral artery disease, the symptoms to recognize, why it matters as both a leg problem and a warning sign for the heart and brain, what you can do, and when to see your doctor. And I'll keep this calm and practical, because while poor leg circulation deserves real attention, understanding it lets you recognize an important clue, protect your legs, and address your whole cardiovascular health in partnership with your doctor. As always, this is about understanding and partnering with your doctor. Let me start with what poor leg circulation usually means, because understanding it shows why it matters beyond the legs. The most important cause of poor circulation in the legs in older adults is peripheral artery disease, often called PAD, which is the same artery clogging process I've discussed. Atherosclerosis, the buildup of fatty plaques narrowing the arteries, but occurring in the arteries that supply the legs. When these leg arteries narrow, the legs and feet don't get enough blood, especially when they need more, like during walking, causing the symptoms I'll describe. Here's the crucial point. Peripheral artery disease is not just a leg problem. It's a sign of widespread artery disease, because if the arteries to your legs are clogging, the same process is very likely affecting the arteries to your heart and brain. So peripheral artery disease is a strong marker that you're at higher risk of heart attacks and strokes. So poor leg circulation usually means peripheral artery disease, the narrowing of the leg arteries by the same artery-clogging process that affects the heart and brain, which is exactly why it matters beyond the legs, as both a leg problem and a warning sign for your whole cardiovascular health. Understanding that leg circulation reflects your arteries generally is the key insight. So poor leg circulation signals widespread artery disease, so it's a clue to your whole cardiovascular health. Let me describe the symptoms of poor leg circulation, because recognizing them is what gets this identified. Peripheral artery disease and poor leg circulation can cause several symptoms, though sometimes there are few or none, which is part of why it's missed. The classic symptom is pain, cramping, or aching in the legs, often the calves, that comes on with walking or exertion and eases with rest, called intermittent claudication, because the muscles need more blood when working than the narrowed arteries can supply. So leg pain on walking that's relieved by rest is a hallmark worth recognizing. Other symptoms can include coldness in the lower legs or feet, especially compared to the other side, numbness, tingling or weakness in the legs, changes in the skin of the legs and feet, like a pale bluish or shiny appearance, or hair loss on the legs, slow healing sores or wounds on the legs or feet, or sores that don't heal, which is important and concerning, weak pulses in the feet, and, in advanced cases, pain even at rest, especially at night. So the symptoms of poor leg circulation include leg pain or cramping on walking that eases with rest, cold lower legs or feet, numbness or weakness, skin changes, slow healing or non-healing sores, and, in advanced cases, rest pain, though sometimes symptoms are few. Recognizing these, especially leg pain on walking and slow healing sores, is what leads to getting poor circulation identified. So knowing the symptoms, especially walking pain and non-healing sores, helps recognize it. So recognizing the leg symptoms is key. Let me explain why this matters so much, because it matters on two big levels. First, as a warning sign for your heart and brain. Because peripheral artery disease reflects widespread artery disease, having it means you're at significantly higher risk of heart attacks and strokes. So recognizing poor leg circulation is genuinely valuable as a warning that prompts attention to your whole cardiovascular health, controlling the risk factors and getting the protection that reduces your chance of these devastating events. This warning sign value is one of the most important reasons to recognize leg circulation problems. Second, as a leg and foot problem in its own right. Poor circulation can cause pain that limits your walking and quality of life, and importantly, the poor blood supply means the legs and feet heal poorly and are vulnerable. So sores and wounds may not heal and can become serious, especially combined with diabetes, which I've discussed, raising the risk of serious foot problems, infections, and in severe cases worse. So poor leg circulation is a genuine threat to the legs and feet that needs care. So poor leg circulation matters both as a warning sign of widespread artery disease and higher heart attack and stroke risk, and as a leg and foot problem causing pain and threatening healing and foot health, both of which make recognizing and addressing it genuinely important. So it matters as both a cardiovascular warning and a direct leg and foot threat. So the two-level importance makes it well worth heeding. Let me give you what you can do, because there's a great deal that both protects your legs and your whole cardiovascular health, and they overlap. The encouraging thing is that the measures for peripheral artery disease are largely the same heart-protecting measures I've discussed, since it's the same artery disease. First, and crucially, don't smoke, because smoking is one of the most important causes of peripheral artery disease and dramatically worsens it. So stopping smoking is one of the single most important things for your leg circulation and your whole cardiovascular health. Second, stay active and walk because, perhaps surprisingly, regular walking, even though it may bring on the leg pain, is actually a key treatment for peripheral artery disease, as supervised or regular walking programs can improve the symptoms and walking distance over time by encouraging the circulation. So walking, as your doctor advises, genuinely helps alongside its broad heart benefits. Third, manage the cardiovascular risk factors with your doctor. Control blood pressure, cholesterol, and diabetes, and take any medications your doctor prescribes, which both treat the peripheral artery disease and protect your heart and brain. Fourth, eat a heart-healthy, artery-protecting diet as I've discussed. And fifth, attend to careful foot care, especially given the poor healing and especially with diabetes, as I've discussed, inspecting your feet, protecting them, and getting any sores or wounds attended to promptly. So not smoking, regular walking, managing cardiovascular risk factors with your doctor, a heart-healthy diet, and careful foot care both improve your leg circulation and protect your whole cardiovascular health. So the heart-protecting measures, plus walking and foot care, address both your legs and your heart. So the same measures protect legs and heart. Let me say more about the treatment and your doctor's role, because peripheral artery disease should be properly assessed and managed. If you have symptoms of poor leg circulation, see your doctor, who can assess it, including checking the pulses and circulation in your legs and feet, and doing simple tests like comparing the blood pressure in your ankles and arms, and arrange further tests if needed to diagnose peripheral artery disease. Then, management includes the lifestyle and risk factor measures I described, which are the foundation, along with medications your doctor may prescribe to improve symptoms and, importantly, to reduce your cardiovascular risk, like those for cholesterol, blood pressure, and preventing clots. And in more significant cases, procedures to improve the blood flow may be considered. Crucially, because peripheral artery disease signals higher heart attack and stroke risk, diagnosing it prompts your doctor to address your whole cardiovascular risk, which is a major benefit of recognizing it. So seeing your doctor to assess and diagnose poor leg circulation and following the management, lifestyle, and risk factor measures, medications, and procedures if needed, both treats your legs and, importantly, protects your heart and brain by addressing your overall cardiovascular risk. So proper assessment and management by your doctor address both your legs and your whole cardiovascular health. So your doctor's assessment and management are central. Let me be clear about when to see your doctor, including more urgent situations, because some leg symptoms need prompter attention. See your doctor about symptoms of poor leg circulation, leg pain or cramping on walking that eases with rest, cold lower legs or feet, numbness or weakness, skin changes, or weak foot pulses, both to assess and treat the circulation and, importantly, because it signals higher cardiovascular risk that should be addressed. See your doctor promptly about any sore or wound on your legs or feet that isn't healing, which, with poor circulation and especially with diabetes, needs prompt attention to prevent it becoming serious. Signs of infection in a leg or foot wound, or worsening symptoms. And seek urgent or emergency attention for signs of a sudden, severe loss of circulation to a leg or foot, such as a leg or foot that suddenly becomes very painful, pale, cold, and numb, which can indicate a sudden blockage of blood flow needing emergency care, as I've mentioned elsewhere, or for the rest pain and non-healing of advanced disease. The doctor will assess your circulation, diagnose peripheral artery disease, manage it and your cardiovascular risk, and refer you to a specialist if needed. So symptoms of poor leg circulation warrant seeing your doctor to assess and treat it and address your cardiovascular risk. Non-healing sores warrant prompt attention, especially with diabetes, and a suddenly painful, pale, cold, numb leg or foot warrants emergency care. So see your doctor for the symptoms, promptly for non-healing sores, and urgently for a suddenly cold, pale, painful leg. So know when to see your doctor and when it's urgent. Let me paint you a picture of how recognizing this helps. Picture a man in his 70s who gets a cramping pain in his calves when he walks any distance, which eases when he stops and rests, and who's been dismissing it as just aging or aching legs, not connecting it to anything serious. In the unaware version, he doesn't realize this is the classic symptom of peripheral artery disease, signaling that the same artery clogging affecting his legs is likely affecting his heart and brain, so he misses both the chance to treat his legs and the crucial warning to address his higher heart attack and stroke risk. Now picture him understanding the connection. He recognizes the walking pain as a possible circulation problem and sees his doctor, who assesses him, diagnoses peripheral artery disease, and, crucially, recognizes it as a marker of his overall cardiovascular risk, so addresses his whole picture. He stops smoking, which is the most important step, takes up a regular walking program that improves his symptoms over time, and his doctor manages his cholesterol, blood pressure, and other risk factors, and prescribes protective medication, while he attends to careful foot care. His legs improve, and, just as importantly, his risk of a heart attack and stroke is reduced by addressing the widespread artery disease his leg symptoms revealed. The same man, but recognizing his leg symptoms as a window onto his whole cardiovascular health, protected both his legs and his heart and brain. That contrast is exactly why understanding leg circulation matters. So recognizing the leg clue protected his whole cardiovascular health. And let me speak directly to those of you caring for or close to an older person, because leg circulation symptoms are easily dismissed and are an important clue. Understand that poor leg circulation usually means peripheral artery disease, the same artery clogging that affects the heart and brain. So it's both a leg problem and an important warning sign of higher heart attack and stroke risk. You can help by understanding the symptoms, leg pain or cramping on walking that eases with rest, cold lower legs or feet, numbness, skin changes, and slow healing sores, and encouraging a doctor's visit to assess them, since recognizing peripheral artery disease prompts addressing the whole cardiovascular risk. Support the measures, which protect both legs and heart, most importantly, not smoking, regular walking as the doctor advises, managing cholesterol, blood pressure, and diabetes, a heart-healthy diet, and careful foot care. Importantly, ensure that any non-healing sore or wound on the legs or feet gets prompt attention, especially with diabetes, and know that a suddenly very painful, pale, cold, numb leg or foot needs emergency care. Helping a loved one recognize their leg circulation symptoms as a window onto their whole cardiovascular health, get them assessed, and address the risk factors can protect both their legs and their heart and brain from a clue too easily dismissed as just aging. So your help recognizing and acting on the leg clue genuinely protects them. Let me draw this all together. The circulation in your legs is genuinely worth understanding because poor leg circulation usually means peripheral artery disease, the same artery clogging process that affects the heart and brain, occurring in the leg arteries. So it's both a leg problem and an important warning sign of widespread artery disease and higher heart attack and stroke risk. The symptoms include leg pain or cramping on walking that eases with rest, the classic sign, cold lower legs or feet, numbness or weakness, skin changes, slow healing or non-healing sores, weak foot pulses, and in advanced cases, rest pain. Though sometimes symptoms are few, it matters both as a warning sign prompting attention to your whole cardiovascular health and as a leg and foot problem causing pain and threatening healing, especially with diabetes. The measures, largely the same heart-protecting ones, are crucial. Above all, not smoking, plus regular walking, which genuinely helps, managing cardiovascular risk factors with your doctor, a heart-healthy diet, and careful foot care. Symptoms of poor leg circulation warrant seeing your doctor to assess and treat it and address your cardiovascular risk. Non-healing sores warrant prompt attention, especially with diabetes, and is suddenly painful, pale, cold, numb leg or foot warrants emergency care. So here's what I'll leave you with. First, understand that poor leg circulation usually means peripheral artery disease, the same artery clogging that affects the heart and brain, so it's both a leg problem and an important warning sign that you're at higher risk of heart attacks and strokes, not just aging or aching legs. Second, recognize the symptoms. Leg pain or cramping on walking that eases with rest, the classic sign, cold lower legs or feet, numbness, tingling, or weakness, skin changes like paleness or shininess, slow healing or non-healing sores, and weak foot pulses, though sometimes symptoms are few. Third, understand why it matters on two levels: as a warning prompting attention to your whole cardiovascular health, and as a leg and foot problem causing pain and threatening healing, especially with diabetes. Fourth, take the measures that protect both your legs and your heart. Most importantly, don't smoke, since it's a major cause and dramatically worsens it. Do regular walking as your doctor advises, which genuinely improves symptoms. Manage your cholesterol, blood pressure, and diabetes with your doctor, and take any prescribed medications. Eat a heart-healthy diet, and attend to careful foot care. And fifth, see your doctor about symptoms of poor leg circulation to assess and treat it, and address your cardiovascular risk. Seek prompt attention for any non-healing sore or wound on your legs or feet, especially with diabetes, and seek emergency care for a leg or foot that suddenly becomes very painful, pale, cold, and numb. Poor leg circulation is an important clue to your whole cardiovascular health and a genuine threat to your legs, so recognizing and addressing it protects both and is well worth understanding. So take care of yourself. Recognize your leg symptoms, don't smoke, walk, manage your risk factors, care for your feet, and get poor circulation assessed. And because diagnosing and managing peripheral artery disease and protecting your cardiovascular health require a doctor, please treat symptoms of poor leg circulation as your reason to see your own physician, who can assess and treat it and address your risk, rather than as a substitute for that care. Seek prompt attention for non-healing sores, and seek emergency care for a suddenly cold, pale, painful leg or foot.